So I'm going to talk to you a little bit today about how to help calm down a child whenever they're experiencing dysregulation. So first and foremost, I want to explain what dysregulation is and what that would look like in a child. So dysregulation is whenever something is going on in their system that's creating some high arousal. And so that could be a very stressful situation. This could be something where they've gotten overtired or overstimulated, which again, those are stressful situations. And as a result, that higher level thinking is just completely offline. We may see tantrums, we may see anger, aggression, we may see dissociation and disengaging. There's a lot of different things that could be going on in those situations. And so we have to look at, as the adults, how can we help calm them, soothe them, and connect with them in those moments to get them back online and help create a sense of calm for them. So first and foremost, my name's Lowry. I'm a licensed marriage and family therapist located in Clovis, California, and I have a private practice that provides equine-assisted psychotherapy, and I also do traditional mental health treatment for people suffering with anxiety, depression, trauma, and just a variety of different mental health issues that are related to their life experiences. I just got back from training with Dr. Bruce Perry, which is a world-renowned trauma researcher who talks about his neurosequential model of treating trauma and understanding how to work within the brain system rather than going from top down, which would be working with the higher level processing up in your neocortex and the part of your brain that's going to be focused on actual problem solving and thinking about consequences and issues like that, and working through our systems from the top down. Instead, we're going to be looking at how to regulate a child from the bottom up, where we're looking at how do we get them to calm down, feel safe, feel connected, and then we can start accessing some of those higher levels of thought, which are pretty much offline whenever someone's dysregulated. So anyways, I'm at the training and I was thinking to myself, okay, he's talking about how in a traditional classroom you have a child who gets upset and they run to the back of the class and they're disengaged and they're upset, and the teacher comes at them and it says, you need to get back in your seat, and the kid's not listening and the kid's completely offline, and the teacher comes at them again, finger out, aggressive, eye contact straight on the child. Our body language is presenting in a way of, I'm dominant, you need to be listening. And think about it, our police officers unfortunately have to work the same way in many situations. And what it does is it actually creates a higher fear response or stress response for these individuals, and therefore they continue to disengage more and things amplify and escalate. You can tell a kid who's upset, you need to think about what you're doing right now, you need to consider this. There's no thinking going on. And so we have to look at how can we change our approach as the adults in this situation in order to help calm them down. And by doing so, we can actually have a greater effect. So I thought about it in the context of when I'm working with horses. If a horse is spooky or we're having a problem with them, going at them head on isn't going to fix the problem. Usually we have to change a little bit about how we are connecting with the horse and changing not only our proximity, where sometimes we take a little bit of pressure off, we'll step away a little bit. That gives them a little more space where they can feel safe. We also will change the way we're looking at them because we don't necessarily want that direct eye contact that can be intimidating. And so by doing so, our physical changes in our behavior starts to create a sense of safety for the individual that we're working with, whether that's animals or people. So anyways, kind of in the horse example, I may take that moment and I'll also change the way I'm communicating verbally. Rather than going, whoa, knock it off, you need to stop, or something very aggressive, I would take a more soothing tone. Whoa, whoa, easy, easy. Something very rhythmic, which can be very regulating for our systems. And, once we're able to get close enough to where we can actually connect, usually then we're doing some stroking or, something very soothing like that. Something, again, very rhythmic, very calming. If you think about us as humans, whenever a baby's upset, what do? We shh, shh, it's okay, shh. And there's a lot of rocking and rhythmic. Those are very soothing regardless of age, regardless of, different circumstances. That's something that can help calm us down in those situations. And again, whenever that higher level thinking's offline, we're looking at lower level systems in the brain. How do we calm? How do we soothe? And so changing proximity, changing our approach, and then also changing the way that we speak or the way we communicate By not coming head on, also, we can come alongside and create that sense of, hey, come over here, come sit with me. And coming alongside again takes that pressure off and creates more connection. In these moments, this is a greater opportunity to help calm someone down who is experiencing that dysregulation, and it can be a simpler way to get whatever you're trying to communicate across, and you'll end up actually seeing more compliance through that connection. So it's something to think about. If you want to learn more, please follow along on our Facebook page for Tailwinds Therapy, or you can go ahead and check out our website at www.tailwindstherapy.com and stay tuned for more. Thank you.